The cost of IT in business can be staggering. From hardware and software expenses to services like internet and phone, you don't need to spend a fortune on IT to succeed. If your organization spends more than $500 monthly on any service, or you're considering signing a long-term contract, IT Enabled can help you manage your technology and minimize your costs. Contact us today to schedule a free consultation. IT Enabled, we're here to help.
Hi, I'm Tara Watson-Watkins, President and CEO of the Lufkin Angelina County Chamber of Commerce. Welcome to the Connect podcast, connecting business to the community. I'm here today with my co-host, Blake Pollino with BP Media Group.
On this week's episode, we have Jessica Duckworth and Brandi Hamilton of The Rose here to talk about an amazing women's service that they provide here for the community. It's truly inspirational. They talk about some public service announcements of some of the needs of the women here in our community.
Well, we're so excited to have you all with us today. Thank you for joining us on the podcast.
Yes, thanks for having us.
Yeah,
Thank
of course. Why don't you tell the listeners who you are, a little background history, and then we'll talk about what The Rose is.
Great, thank you. My name is Jessica Duckworth. I'm the Chief Operating Officer at The Rose. So I've been with The Rose for a little over 8 years, and I'm a breast cancer survivor.
That's great.
Yes, and I'm Brandi Hamilton. I am the Mobile Hub Program Manager for this East Texas area. I've been with The Rose since the beginning of this year.
Okay. So brand new, a couple of months in.
Brand new, yes ma'am.
Good. Well, you know, The Rose is an investor here with the Chamber, and we're honored to have y'all. But I think there's still a lot of people that aren't familiar with all that you do. So why don't you let the listeners know really what The Rose is and all of the benefits that you can get from working with y'all.
Wonderful. So The Rose has been around for 35 years. We started in 1986 out of the need to provide breast cancer screening to women, no matter their ability to pay. So we see both insured and uninsured women. Okay. So we provide screening and diagnostic mammogram services, as well as patient navigation services for women once they are diagnosed with breast cancer, to help them through the next steps that they'll be going through in their cancer treatment.
That's great. That's great. And where are you located?
So our headquarters is in Houston. So we have 2 physical locations in Houston, and then we have our mobile mammography fleet, which right now we are at 4 mobile mammography units. And we've just opened our first satellite hub here in Lufkin, which we're so excited about and so excited to be a part of the community here in East Texas.
It's great. Tell us about the hub. So what is the hub? How does that work?
So we have our mobile units that go out and provide screening mammogram services. Currently, right now, we're in 43 counties. So we provide services to 43 counties. We started our mobile coach program in 2017 through a generous donation with the Temple Foundation. Okay. We actually launched our first coach here in Lufkin. We had our first event, and that was Rosie. And we take our units out to the community to provide life-saving screening mammograms. Over the years, the need has increased, and so the program has increased. So we've gone from 1 unit with Rosie to now she has 3 sisters.
Awesome.
She has Hope and she has Misty.
Cool.
And then she has our newest arrival, Lily.
That's awesome.
So we've been here in the East Texas area since the beginning. As a matter of fact, we've seen about 7,600 women in East Texas. Wow. And of those, most importantly, we've diagnosed 56 of them.
That's awesome.
So when we were bringing on our next unit, we were looking at how could we better serve the community. One of the challenges is distance, right? Because we are located in Houston, and so driving to all of the counties to provide all of the services. Right. So we kind of got together and said, what would make that easier or make it more readily available to the community? And so that's where the idea of the hub came from, to be able to position one of the units more centrally. And so when we started looking at the areas, Angelina County and right here in Lufkin was just an obvious choice for us to be able to do that so that we could service all of the communities around here.
So how does that process work? I imagine it's a little kind of like a blood drive, right? Where the coach rolls in and then everyone can come in and they can get the screenings there. Is that kind of how the process works?
That's right. I'll let Brandi describe the operation.
Absolutely. So the mobile side of it, so if you have an organization that wants to have a mobile day, I coordinate with them as far as all the patients come in. How many do we have for the day? Our minimum is 20 women to be pre-registered. So we get our list together of the women. Now, we did mention that we take insurance as well as uninsured. My primary role here in East Texas is to drive that insurance part of it. So for every 3 insured women, that covers 1 uninsured woman for her to get her mammogram services, as well as that continuum of care if needed. So I really just partner and act as that liaison to ensure that we can set up the mobile day. Our coach, it does arrive to the organization at a designated place that is safe for patients to enter and exit safely, safe for our staff. We can go anywhere. We've been at schools before. We've been at different businesses, such as like a Chick-fil-A. We have many different partners, primarily clinics, but we can go anywhere. So as long as we have enough of an interest and that minimum number of ladies to be pre-registered, we can make a mobile day happen.
That's great.
That's awesome.
So how can people, like if I need a mammogram
Yeah.
and I don't want to go to one of the hospitals, do I just reach out to you? How does that work?
Yeah, absolutely. So you can reach out to us directly. You can go online to therose.org, and we actually have a mobile team email. So it's mobileteam@therose.org. For example, say you wanted to maybe have us here, you want to request our mobile services. When you go on to therose.org, there's a place that says mobile mammography, and right below that, you can press request services. You'll put in your name, your organization that you're interested in. It's an automatic request that myself, along with the rest of the team members, they get that email as well. The other way you can do it is you can call our direct mobile number, which is 281-484-4708. You can let them know your name, what area you're at, and then they'll transfer the call or the information to me, and I'll follow up with you.
Okay. That's great. And do you do all the same services that would happen if I were to go to a hospital?
So
Or
on
to
our
the diagnostic clinic or whatever?
Right. On our mobile units, we offer screening mammography.
Okay.
And then if additional testing is needed,
Then you would send on.
we coordinate that either through one of our
Yeah.
facilities or with a local provider to receive the
But
additional
for
testing.
just your normal yearly mammogram that you need,
Yes,
those services can be done with you.
absolutely.
That's great.
That is correct. And we have our coach, it is a 3D tomosynthesis. That is one thing that stands out about us. A lot of places aren't, they're still doing 2D. So that's one thing I want to highlight with our coach that's here in this area. We can do that additional diagnostic look at the breast itself, and then just it gives a better read. Correct. Exactly. So I thought that was pretty neat. Not only are you coming and getting a service that's fast, efficient, and accurate, but you're also getting a really good image where we're able to tell, hey, you're okay, hey, we need to call you back, but we have it all set up to help take care of each and every single patient.
And you still work with a radiologist to read the
Yes.
I guess the screenings and things like
Right.
that.
All of our radiologists are board certified breast imagers.
Okay.
That read the mammogram, and then we provide a copy of the results to the provider, the ordering provider, as well as we send a letter to the patient letting them know that their screening was clear, or that we may need a little additional testing just to verify.
Sure. That's great.
So as a way of just sort of a PSA for our listeners or whoever's listening, why is this screening important? So why do people need to do this? Why do women need to do this? Just kind of spread that message for our listeners and why this is important and why they should be doing it.
Yeah. I mean, prevention is key. And if we can't prevent, then let's at least catch it early. I'm a big breast cancer awareness advocate. My grandmother was a survivor. We got a lot of years left out of her because she was proactive in her health. She got it taken care of. She beat it. And so with that, I have such a heart to really tell women, you should take care of yourself. Listen to your body. You know your body more than anybody, and that could give you more time and more years with your loved ones. So it is extremely important to go ahead and take that precautionary measure.
How long does a mammogram take? So if you're scheduling this out, it's really, really important. How often should you do it, and how long does that process take?
You should do it annually after the age of 40.
Okay.
If you have any kind of family history, you may need to start earlier than 40, and your doctor would be able to advise you of that. But definitely annually after 40, and it's about a 15-minute procedure.
Yeah, well worth it.
Well worth it, definitely. Our CEO and co-founder always says it's not about finding cancer, it's about finding it early.
That's right.
To give you the best chance of oh goodness, I just went blank.
No, you were totally fine.
To give you a chance of survival.
Correct.
We survey our patients on our mobile coaches, and 65% of them tell us that they would not have had their screening mammogram if it weren't for the mobile coach coming to their community, or coming to their church, or coming to their place of business. So that's a big number that drives this program definitely, and where we go.
I think so many women are afraid to get a mammogram because I think they're afraid that it's going to hurt so bad.
Right.
Yes.
It's afraid of the unknown. And yes, it's uncomfortable, and it's not something that you would want to do every day. But if it's going to be 15 minutes of holding your breath versus, not surviving cancer and not catching it early, it's so well worth that 10 seconds where they say take a deep breath and hold it.
Yes.
And you're like, I've been holding my breath, this hurts. I'm not breathing already.
Exactly.
But it's like you said, and with you being a breast cancer survivor, this is your passion and what you want to help other women.
Absolutely. And all of our equipment, both at our centers and on our mobile coaches, are equipped with the Smart Curve paddle, which is a new paddle that the vendors came out with that makes the mammogram a little bit more comfortable.
Yeah.
So instead of a flat plate, it's curved to make that pressure that you're experiencing less than what women are used to receiving when they have their mammogram. But yes, the passion is definitely there. I was one of those that, delayed getting my first mammogram whenever I was 40. Why? I don't know. It was just down the hallway. I'm at the clinic every day, and I could have done it, but I was more worried about spreading the message and getting women in and not thinking about myself. Wow. And so, I ended up being one that found a lump right before COVID started, and then had to wait through COVID before I could get it worked up. And so, went through extensive treatment, and that's always in the back of my mind. If I would have done it earlier and caught it earlier, then my treatment would not have been as extensive as it was. That's right. So that's always that message. The sooner that we can catch it, the better the outcome is for your survival as well as for your quality of life once you complete treatment.
That's great.
So as an organization, what needs does the Rose have? What help do you need as an organization?
Yeah. So honestly, I think our biggest thing for this area, we're brand new, but as you mentioned, people don't know that we're here yet. Mm-hmm. It is so rewarding to get done with the mobile day and to hear these women say, I've never had a mammogram before, but because of y'all, I finally had one. Or like you mentioned, Jessica, this wouldn't have happened, had y'all not came. So to really help these women to know that the need is here. So with that, with the community, let us help you. Let us serve you. If you're interested, whether it be yourself or your organization, call us, email us. Let us know that you want us to come out. We can pull a mobile day together to help take care of you, your coworkers, your whole entire company.
Well, we're going to have to get you signed up to come to the chamber.
Yes.
We're a great location. We're a great spot.
That's
and so
perfect.
we need to get you on a rotation to be able to come. Where we can send it out to the investors and to the community.
Right.
That would be awesome.
And giving back. If you're going to have your mammogram, which you need to have your mammogram, but having your mammogram through the Rose, if you are insured, by having that 3-to-1, where 3 insured women gives back to 1 uninsured woman, having that service with us and being able to give back to the community is always something that we like to
Absolutely.
to share with the community.
That's right. Well, where can people find you? How can they find you? Websites, Facebooks, things like that?
Yes, absolutely. So our direct website is www.therose.org. That has all of our information, including our mobile mammography program, where you can request that service.
And you can also see if it's in your area to be able to go sign up that day.
Absolutely.
Yeah.
Absolutely. And then when you call, it's our main mobile team phone number. However, of course, they'll transfer it over to the East Texas area so we can take care of you.
That's great.
You can always follow us on social media as well. We have Rosie on the road. And so a lot of times you be able to see where she is or where we're going with her.
That's great.
If you see her out on the road, wave, take a picture.
Yes.
We always like to share that.
That's great.
And then, we're just so happy to be a part of the community here. And, that would not have been possible without the generous, contribution from the Temple Foundation. We have an anonymous donor who helped us with the purchase of Lily, who is here. And then we have the Cancer Prevention Institute of Texas and the Episcopal Health Foundation both fund us to be able to cover the cost of the mammograms for the uninsured women that we
great.
see.
Yeah,
That's great.
So we're very grateful to them, and also very grateful to the chamber,
Thank you.
for allowing us to be a partner and for sharing with the community that we're here.
Well, it's a great team passion, and so we're honored to have y'all.
Thank you.
Yes, thank you.
Awesome. Well, thank you so much for coming on the podcast. We truly appreciate you being here. And please check this organization out. If you're listening to this, make sure that you go check out their social media, give them a like, a follow, and support them any way that you can. We want to thank you so much for listening again this week. We truly appreciate everyone who's listening to this podcast every single week. It just blows our mind, the support that we're receiving when each of these episodes comes out. So if you'll do us a favor and subscribe wherever you're listening so that you're able to get these episodes when they come out every single Monday. And if you also rate and review the podcast wherever you're listening, that helps other people who are interested in this type of podcast and type of storytelling that we do here to find the podcast. Thank you so much, and we'll see you next week.